Okay, so for the medical exam, guys, you guys can come in, and once you walk in, you can say, hey, I have a clean pair of gloves on, do you mind if I write a few things on my hand? Okay, so then what I do is I write down chief complaint, OPQRST, ample, and then pulses, respirations, and blood pressure, so I don't forget to check anything, okay? Another thing that I put on there is FI, which stands for field impression, because that's the one thing that a lot of people typically forget, okay? So now I have it all written on my hand, and as long as you walk in with clean gloves, you should be allowed to do that, okay? So, I'm gonna come in, what's my dispatch?
Guy who's been stung by a bee.
Stung by a bee. All right. So I'm going to come in and say BSI, scene is safe. Is my scene safe?
Yeah.
The bee gone?
Yes.
Okay. My mechanism of injury is a bee sting. Okay. My nature of illness is a bee sting. I have one patient. Is that correct?
Yeah.
Okay. I will call for ALS just to be safe, and then I'm probably not going to consider C-spine at this point, but I may change that as I go through. Okay. My general impression is probably good to bad, somewhere in there. And I am going to check the level of consciousness. I'm going to come up to my patient and say, hi, my name's Tony, I'm an EMT, can you hear me?
Yeah.
Okay, so my patient is talking to me, they are alert on the verbal scale, or on the APCU scale, and that means that the airway is at least open, okay? So I'm going to take a quick chance and try to make sure my airway is actually open. Do you have any sort of stridor or any noises that I need to be aware of?
Not at this time.
Okay, so my airway is open, he's talking to me, so I don't really need to put in an OPA or MPA at this point, okay? I'm gonna check for respirations, okay? So I'm gonna sit for 30 seconds, and I'm gonna hold my hand just under your nose, will you please breathe through your nose?
Okay.
And I'm gonna watch for chest rise and fall for 30 seconds. Okay, in the interest of time for taping, I get a respirations rate of 16. What's my respiratory rate?
22.
22? Okay. So at this time, with the respiratory rate of 22, I'm going to put a non-rebreather on the patient at 15 liters a minute to take care of the oxygen. Okay. The next thing I'm going to do is I'm going to check the pulse. So I'm going to sit here for 30 seconds, taking the pulse. Okay. And in the interest of time, I get a pulse of 82. What's my actual pulse?
108.
108. Okay. So I have a pulse of 108. I'm going to do a quick scan for any bleeding. Do I have any major bleeding?
No.
Okay. And I am going to check skin conditions. Does it appear warm, pink, and dry?
I'm more pink and dry, but there's major swelling around the sting area.
So we got major swelling in the sting area. Okay. So I've gone through airway, breathing, circulation. Okay. I've already got them on oxygen. I'm going to keep them in a position of comfort, and I may cover them with a blanket to help with shock if he looks like we're going to be going into shock. Okay. So I'm going to do a quick scan from head to toe. Did you fall or anything, or did you just get stung?
Just got stung.
Okay. So do you have any pain in anywhere else other than just the bee sting area?
I'm having more and more trouble breathing now that this is here.
Okay. So I've gone through rapid scan. My transport decision with the bee sting is going to be load and go just to be safe, and going to go through and collect the history. So when did you get stung? How long ago?
5 minutes ago.
Okay. And does anything make your pain or discomfort better or worse?
No.
Just kind of consistent.
Just kind of
a little
consistent.
bit worse.
Yeah.
Okay. And can you describe the pain to me? Are you in any kind of pain besides the sting?
It's not really a pain, it's just constriction.
Starting to get tight chest.
Yeah.
Okay. Does it radiate anywhere?
No.
Okay. On a scale from 1 to 10, how much discomfort are you in? 1 being easy, 10 being
4.
worse. 4. Okay. And is it constant or does it come and go?
It's constant.
Okay. Do you have any allergies?
I have bee sting allergies.
Bee sting allergies.
Yes.
That's kind of interesting. Okay. Do you have any medications?
I have an epinephrine pen.
Okay. Have you used it yet?
No.
Okay. Do you have any pertinent medical history other than the bee sting allergy?
No.
Okay. And what was the last thing you ate or drank?
Los Betos.
Nice, good word. Okay. No wonder you had chest pain. And what were you doing when you got stung?
I was mowing my lawn.
Okay. So at this time, I'm going to do a focused exam on the bee sting. I'm going to take a look at the sting and see if the stinger is still in there, and I'm going to assume that it is. So I'm going to take a credit card and I'm going to slide down to break the stinger off, whatever is left. Okay. I'm going to gonna do a little bit more listening to his chest, so I might actually inspect the chest, and I'm gonna auscultate the lungs, okay? And do I have any abnormal lung sounds?
What would it be?
Wheezing.
I have more wheezing.
Is it getting to be severe?
It's getting to be severe.
Okay, we're gonna have severe wheezing going on, okay? I might stick on the SpO2 monitor on his finger to take a look at what's going on with his oxygenation. What's my SpO2?
92.
92 on non-rebreather. Okay, so that's a little bit low on a non-rebreather. So I'm going to take a set of vitals. Okay, I'm going to get the blood pressure cuff. Okay. And the bulb came off. That's awesome. Okay. Can I have one of your arms? So I test the blood pressure cuff, making sure that it takes at least 1/3 of the chest, or sorry, of the arm. Okay, the chest would be quite a large blood pressure cuff. Okay, just to hold your arm there. Okay, I got 132/58, kind of an abnormal blood pressure. Okay, but what's my actual blood pressure?
160/130.
Okay, and I'm also going to auscultate the lungs again just to check how we're doing on the breathing. So take a deep breath for me. Okay, and I hear clear, so the wheezing is getting worse.
The wheezing's even worse than it was.
Okay, so I have wheezing in the lung fields, taking the blood pressure. I'm going to take another pulse. Okay, I get a current pulse of 82.
It's 82.
Okay, so pulse has come down. And respirations are still
Respirations are agonal and
agonal.
yes.
Your heart stopped now.
Well, not agonal. I mean, not irregular. What would it be? Takes effort. What's that called?
Okay.
Effort
with breathing.
Effort with
Labored.
breathing. Labored breathing. That's the word.
What
And
are we at?
shallow at 28.
28. So he's deteriorated. I need to get a BVM on him, so I'm going to have Casper switch over to a BVM, lay the patient down, put him on a BVM. And my field impression is that the patient is having an allergic reaction. I'm going to contact medical control, and I am going to ask for permission to deliver the epi. Do I have permission?
Yes.
Okay, so I'm going to hold the epi. Can I borrow that there? Okay, hold this in the middle. I'm going to pull the cap off, okay? And I'm going to deliver it in the lateral thigh. Press in until I hear it click. Hold for 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Pull straight out. Put it into a sharps container, and then massage the area. Is that starting to make an effect on you?
Yes.
Oh, you can breathe better. Is the wheezing starting to go away? I'll auscultate the lungs again.
Yes.
Okay, and so now that we're on the way to the hospital, I would reassess him. He's probably becoming a little bit more stable, but just to be safe, I'll reassess him once every 5 minutes on the way to the hospital. And then the proctor will say,
patient transfer report is requested at this time.
okay, I have an 18-year-old male who was stung by a bee, and he was stung approximately 5 minutes before we got there. He was starting to have a tight chest with no radiating pain. He was at a 4 when we started. He's allergic to bees. He had an EpiPen, which we delivered en route, and it made a positive impact on the patient. And when we arrived, his pulse was at 108. His respiratory was at 22. And his blood pressure 166/130. We delivered the epinephrine. It greatly reduced his pain, reduced the wheezing, and also reduced his respiratory rate. He's back on it